Hello, I'm Dr. Elaine Hart Brothers, MD.
And I'm Dr. Michelle Laws, PhD, and we're with the Community Health Coalition.
The vision of the Community Health Coalition is a society where all people live a long, healthy, active life full of purpose and promise. Since our founding in 1989, the Community Health Coalition Incorporated strives with its partners to reach health equity and to eliminate racial health disparities in Durham County and the surrounding areas.
We hope you enjoy the program that we put together for you today. Thank you for tuning in again to another segment of the Community Health Coalition's Community and Population Health Discussions. We are continuing our two-part segment on substance addiction and substance abuse and mental health. And we specifically wanted to dedicate this segment to talking about mental health issues. The holiday season is a time of the year where many people struggle with mental health challenges for a variety of reasons, for different reasons. Some people begin to reminisce on times gone by and think about loved ones who have transitioned and gone on. Others deal with mental health issues and crises during the holidays for financial reasons. There are many reasons. I am so glad that we have with us today Dr. Tanya Armstrong, who is a native of Durham and the founder of the Armstrong Center for Hope, which provides psychological and mental health wellness counseling for children and adults. And this year, I'm glad to say, and I want to say congratulations, they celebrated their 7th year anniversary. So that's a big to-do, so congratulations.
Yes, thank you.
Dr. Armstrong is a person of deep faith, and she knows that spirituality is a vital component in the lives of many. Thus, after she completed her doctorate in child clinical psychology at UNC Chapel Hill, she pursued a Master of Theology at Duke's Divinity School. In addition to embracing her role as a minister of congregational care and counseling at Union Baptist in Durham, North Carolina, Dr. Armstrong taught courses in pastoral care at Duke Divinity School, including introductory and capstone courses for the Duke UNC MDiv and MSW dual degree program. That's a mouthful. While she continued part-time clinical work during her years at Duke, her passion for deeper clinical involvement in the community led her to establish the Armstrong Center for Hope as a group practice in August of 2010. Dr. Armstrong says that the sheer volume of calls, the complexity of the presenting concerns, and the dearth of therapists with specialized training in child and family issues, not to mention spiritual integration, were clear signs of a contribution that she could make to the community. In 2012, Dr. Armstrong was recognized in June as one of the Female Entrepreneurs of the Year by the Durham section of the National Council of Negro Women. And since July of 2013, she has served the Apex School of Theology as the Dean of the Master of Arts in Christian Counseling Program. And another great honor, she is the president-elect for the North Carolina Psychological Association. So we just owe you just a barrel of accolades for this awesome work that you're doing.
Thank you.
Clinically, Dr. Armstrong works primarily with children, adolescents, couples, and families on issues of depression, anxiety, ADD and ADHD, grief, loss, and relationship challenges. And I am so excited because part of today's discussion, we will be talking about her newly released book and accompanying CD, Blossoming Hope, the Christian Women's Guide to Mental Health and Wellness. Mental health is a concern that many of us should have. It is estimated that only 17% of U.S. adults are in a state of optimal mental health. There is emerging evidence that positive mental health is associated with improved health outcomes. Mental illness is defined or can be defined as collectively all diagnosable mental disorders or health conditions that are characterized by alterations in thinking, mood, or behavior, or some combination. Depression is just one. mental illness. Depression is the most common type of mental illness, affecting, according to some estimates, more than 26% of the U.S. adult population. But most importantly, the purpose of today's show is to talk about what we can do to maintain optimal or to get to an optimal mental health state, and also help loved ones who are dealing with mental illness and mental health conditions. And so, again, welcome to the show.
Thank you.
We hear this term, or some of us hear this term, about mental health and mental illness, and it provokes or evokes different kinds of responses. How did you get involved in this work? What prompted you to go down this path?
Mm-hmm. Very interesting question. There are many of my colleagues in psychology and the other helping professions that have varied narratives that may include an experience, a personal experience of mental illness. In my instance, I had this sense by age 12 that I wanted to pursue psychology, and specifically child psychology. So I did study that in school, and I've remained very focused on working with children, but also expanding to adults, because one of the things I've realized in my path is that often it's adults and parents who can be supported to be more health promoting of good mental health in their own children. And so if I can work with the parents and make a difference, and the grandparents and the aunties and uncles, then it makes a big difference for children, and so the whole family can thrive. And so probably for, I'd say, over 30 years, I've been very interested in this endeavor.
Wow.
Yes.
And we're so glad that you are involved.
Thank you.
One of the barriers that we hear people talk about in terms of accessing mental health services and treatment is the experience that they've had with a mental health professional, or with someone with whom they sought treatment or help or counseling.
Yes.
What's your philosophy in terms of being a practitioner and addressing mental illness and mental health conditions?
I believe that when we are in a space in life where we're hurting, the most important thing to do is to find someone who can help alleviate the hurting. So having said that, it is also the case that often we have preferences to work with someone who shares a same cultural worldview as we do. So sometimes we may find that we want someone who looks like us, who's had similar life experiences to us. And if we can find that person in someone who is helping us to alleviate hurting, then that's the icing on the cake. But I certainly encourage persons who are hurting to be able to connect with anyone. Sometimes we are pleasantly surprised at who is able to really support us. And so my philosophy is to give the best care and to be able to share the most common experiences where possible. And even when that's not possible, the experience of being human and being able to be transformed into something higher and better is also a really worthy goal.
Speaking of reaching out to people who share similar life experiences and who we can hold a mirror up and say, I see a reflection of me there,
Yes.
or my experience there. What exactly is the percentage of African Americans who are in the mental health profession? Do you know? And what have been some of the challenges getting a more diverse practitioners base?
Yes, there are a number of challenges. Some of the challenges have to do with how we educate mental health professionals. So sometimes it's more difficult for persons of color to obtain access into those programs. Sometimes we don't have enough mentorship for those students to understand, here are the kinds of programs that you want to look at, and here's how you find a good mentor, here's how you request a solid letter of recommendation. So some of it is having to reach back and give information to our mentees on how to step through that process. And some colleagues and I in the group Uzima, which is a therapist consultation group, we recently had a session at one of our local schools, our local HBCUs, North Carolina Central University, where we actually met with undergraduates and gave them tips about if you want to go into marriage and family therapy or psychology or counseling. I think we may have even had someone there who was interested in psychiatric nurse practitioner work or psychiatry. We said, here are some persons and some resources in the local community with whom you can affiliate so that you can learn about that process. So educating mental health professionals is very important. The next area that can be a barrier but need not be a barrier is licensure. So helping our students to learn how to prepare properly for taking the licensing exam, making sure that they've selected programs that will allow them to obtain licensure, and then helping them even if they don't pass the first time or the first few times, just giving lots of encouragement so that they can get back up, because we need licensed mental health professionals in our state and truly in the world to be able to meet some of the need. So even when persons are properly educated and licensed and credentialed, sometimes they have difficulty being able to find the kind of work that supports them. So when I started the Armstrong Center for Hope in 2010, it was with the intent of drawing together a group of like-minded clinicians who were culturally sensitive and could provide that kind of care, mental health support and care for persons in the community. And yet, private practice can be a difficult space in which to exist because of changes that are often happening with insurance companies and denials. And so sometimes you have persons who venture into private practice who find that this is not really the lifestyle that I've thought it to be. And so they may exit. And so for all of those reasons, we have a fairly small proportion of the general population that is actually people of color and mental health professionals. So
We'll
that
have
is a
to
true barrier.
work on that and make sure we get students down into the pipeline to become,
Absolutely.
because I firmly believe that we're living in a particular time in which all of us need a good mental health provider
Absolutely.
on hand.
Yes.
I certainly believe that our whole nation is in a state, I think, right now
Yes.
of mental unrest.
Absolutely.
Let's talk now about mental illnesses. We know that in the substance addiction community, the opioid addiction crisis has monopolized the discourse around treatment and need. What are you seeing, you and your colleagues experiencing in terms of mental illness needs?
Certainly, we've seen a flourishing of persons on the autism spectrum. And so we are noticing both in terms of evaluation and treatment that we've had increased demand at the Armstrong Center for Hope and other practices and clinics across our community. We also are noticing that there continues to be consistent referrals around attention deficit hyperactivity disorder or ADHD. And so we provide quite a bit of evaluation and also treatment for those families. And we know that, for example, within African American communities, that even if a child receives a diagnosis of ADHD, there may be a bit more reticence on the family's part for that child to be placed on medication. And I certainly encourage each family to think very carefully about the pros and cons of any kind of medication, not just for ADHD. But we know that even if parents opt not to give their children medication, that it can be very important for them to be involved in a therapeutic process. So therapy is both about being able to discuss current events and to vent about challenges, but therapy is a place for learning skills. And we know that children and adults alike, once they learn skills of how to be more organized, how to minimize their procrastination, how to pay attention in some specific, using specific strategies, that they can be more effective in the classroom, at home, and in other settings. And so we're glad to be able to address the needs of the ADHD population. We also always will see quite a bit of depression. Depression, as you mentioned earlier, is one of the foremost diagnoses that we continue to see. And we know that there are effective treatments, both including medication, as well as including psychotherapies. There are many different sort of orientations as to how we treat depression. But we would say that a really important factor of almost all of the treatment that we do is the relationship that that client and that family form with the therapist. And so culturally, it can be important for families to find that match, but I will say that it kind of can backfire sometimes. I've had experiences with similarly cultured persons with whom there just wasn't as good of a fit. And I've also had experiences personally as well as professionally where there seems to be this mismatch that works beautifully and healing occurs. And so we certainly encourage persons dealing with all kinds of crises to be open to the care that they can receive, and just to make sure that the person with whom they're working is properly trained and credentialed, but also is a person of compassion who can really make a difference in their lives.
Now you say it's important for the families to be involved. But when you say family, are you talking about a particular, like biological, or can family simply mean a supporting person? Because I happen to think that sometimes the family can be the source that has caused the manifestation of the illness or the disease. So you want to talk a little bit about where people go when they don't have, or what happens and what should they do when they don't have a support system?
Yes. We define family very broadly.
Okay.
We defer to the persons who report for treatment. So often if there is an adult who's bringing a child in, they are either biological parents or they may be guardians. And so we often are working with persons who may be, for example, in DSS custody. And so in that case, you're not working with the biological family, but you're working with persons who care enough to allow this child to reside with them and to bring them for treatment. In some cases, even as adults, family is not biological. You know, we in our African American community have an experience of naming fictive kin. And so you have your play aunts and your cousins and your mothers of the church and so forth,
sisters.
absolutely, who become those persons who are family. So it's not our role as mental health professionals to dictate who is family. We know that in some instances, family is defined as a nuclear unit of parents and children in a household. In other experiences, family is really multi-generational. Family can be blended. Family can be defined in a myriad of ways. And so we really just sort of receive and find that we get the most helpful information from the persons either who are historians of that child or persons who, again, are the caring individuals who will do what is necessary to help the child to make a positive transformation.
Great. Now, when we look at gender and sex orientation, do you see differences in the ways in which women seek treatment, or the different mental health or mental illnesses that are manifest in women's lived experiences versus males or men? Or are there no gender differences?
We do have some gender differences within mental health, but they can sometimes be skewed by the presentation of persons who show up for treatment. So it is certainly true that there are more females than males who present for treatment. That does not mean that more females are diagnosable. It simply means that they are more likely
to seek treatment.
Exactly. We do know that just from our own personal experiences at the Armstrong Center for Hope, that we tend to have more females, both in terms of mothers coming with their children, but also maybe wives coming for marital treatment, and husbands may often say, well, I'm really just here for her. And we hear that often, but the beauty part is that a lot of times when we're really able to engage men in the process, the mainstream perception that therapy is not for men tends to dissipate. And we find that when we have established that strong therapeutic alliance with men, that they are often our most vocal ambassadors about how important therapy can be. So we understand that coming in the door, we're going to more often see women, but when we have opportunities to work with men, we can do some wonderful work with them as well.
Absolutely.
Yes.
Thinking about access, I want to talk about some barriers.
Yes.
I was in an interesting experience the other day in a group, and there was a gentleman who is in a leadership position within the faith community who was using the term mentally ill and mental health as a joke. And I think attempting to criticize or be critical or make fun of someone that was present. And I thought how tragic and sad that is because oftentimes people will make jokes. Oh, she's just clinical, or he's, psycho, or he needs to, have you taken your, you know how the conversation can go.
Yeah.
And I didn't find it humorous. Some people in that group found it humorous. I didn't find it humorous because I know my family's experience and history, and I don't think I'm alone in that. And also because I'm a person of compassion. And I know that there are certain things that we just simply should not make light of because stigma is a huge barrier.
Right.
So let's talk about some of the barriers to care and what's keeping people from getting the available help and the much needed help
Yes.
that they need,
Yes.
the help that they need to get better.
Yes. I would certainly say, after having been in this profession as a licensed psychologist now for 16 years, that stigma remains one of the most powerful barriers to mental health treatment. And that is true across the board, across different communities, but it is especially true in communities of color. And we often find that topics like mental health or substance abuse are viewed as taboo. And we discourage conversation within the family, but we certainly discourage the airing of one's dirty laundry and sharing information with persons that are deemed by the family as a stranger. And so often persons are sort of held captive by those attitudes and don't feel comfortable or don't feel sanctioned by their families to reach out for the help and to really trust that the help is confidential, and that research studies show that mental health treatment really makes a difference and that medication can have a powerful impact. And so persons don't quite make it to the level, unfortunately, of being able to secure treatment. I know that very often, both in the clinical setting in which I work and also the church setting, that we will often hear people comment to us that I held onto your card for 2 years or 3 years before I called. And we know that a diagnosis such as depression, for example, can be diagnosed in as few as 2 weeks. So we're talking about lots and lots of suffering that is occurring as people are torn because of cultural messages that they've received about it not being okay to get help, or that they must be crazy if they decide to seek help. And the tragedy is, and the irony of it, is that sometimes persons are experiencing first milder symptoms of a mental illness, and if they're not treated, then they do worsen in severity to the point that sometimes they require more invasive or intensive types of treatment. And so we really want to encourage persons in the audience to consider seeking help earlier in the process. We know that early detection is a really important aspect of all mental and other types of health treatments. And so that's one of the most important barriers, is the stigma.
Speaking to an individual, if you were having a counseling session, and I want to frame it within the context of the faith community or in the church, I've heard it said a lot of times, just pray about it. Snap out of it, get yourself together, just pray about it, turn it over to God. And I think sometimes our religious beliefs and practices are barriers as well.
Yes.
What would you say to someone who has received that feedback from someone, but yet they're still struggling with a very real and present mental health condition or mental illness? What would you say to that person who's received the just pray about it response?
So I would encourage them to look at where they started and where they are presently to determine, has that been effective for you? And that's not at all to imply that our faith has no power. But what it does imply is that in our faith, we know that there are resources provided by God to support us in becoming well. And so even if we look at the parallels, say, within general health, we know that if someone falls down a flight of stairs and breaks a leg, sadly in our society, we see that whereas that person would not struggle at all with whether they should go and get help and get their leg recast. The parallel within the mental health field is that maybe I didn't pray hard enough. Maybe it was the devil that pushed me down the stairs, or the kinds of messages we say don't match up between treating our general health and treating our mental health. And so I really encourage people to be fair. You know, if you're going to take metformin for your diabetes, then you may also want to consider, is it helpful for you to take Paxil or Prozac for your depression? And I have people to think about it from that perspective. But also, my book actually gets into a discussion about this very issue of stigma. Sometimes we are using faith as a place where we hide. We sort of say that, well, you know, I'm still waiting for an answer from the Lord. And I believe in the experience of those persons who are walking in faith, whatever their faith may be, that our God is one who is a responsive God. So when we pray, there is an answer, and we know that God wants us to be well. And so we have to look and say, am I living up to the wellness that God has destined for me? And if I'm not, then it may be that there's some other resources that I've not yet uncovered that God is providing for me. And that is a reason that we have the Ministry of Congregational Care and Counseling at Union Baptist, so that right there within the walls of the church, persons can see that there is an openly welcomed and sanctioned service that says, here are some services that will help you both in terms of treating your mental illness, but also in helping you to pursue wellness. And they're right here within the church walls, because we believe that this is one of the ways that God heals us, is through these practical mental health services.
Great stuff. What are some signs we should look for, especially during this holiday season? Everybody's supposed to be all happy and just having a wonderful time. It's the
it's the most wonderful time of the year.
Exactly. You took the words right out of my mouth. Exactly. And yet some people aren't tapped into that kind of joy and excitement.
That's right.
What are some signs we should look for, not just in others, but also in ourselves, if we are slipping into a state of, depression or just feeling blue and down? And I know there's a clinical difference, but just in a general sense, what should we look for?
Right, right. Often we find that persons are experiencing depressed mood during the holidays, and that is one of the hallmark signs, of course, of depression. But also persons may be experiencing social isolation. They don't really want to be around a lot of other people. They don't want to be bothered. They may be experiencing some vegetative changes, that is, changes in their appetite, either increased or decreased, changes in their sleep patterns, where they're sleeping more and longer, or less and waking up frequently in the middle of the night, waking up before they intend to in the mornings. So those are also signs that persons might experience at this time of the year. And we know that holiday grief is a real phenomenon. This is actually an experience that my family is going through this time of the year. And it's important for persons to first acknowledge the reality of what they're going through, whether it is holiday grief or whether they suffer from seasonal affective disorder, which is more common this time of the year, or they're having increased anxiety about all of the gifts and preparing for guests and all of the pressures that come along with the holidays. So I encourage people to really be mindful of what they are experiencing and to be able to receive support, because the tendency is sometimes to push the support away, but we need more support during this time of the year. I also encourage persons who may be feeling less than excited about the holidays, especially if it involves grief, is to think about how you might create new traditions. Sometimes we keep doing the same things over and over again and expecting things to be different. And when we see that they're not changing, maybe there's something about ourselves that we need to change. Maybe practices that we can change to be different. Maybe we have different traditions that we observe. Maybe there was something that we used to do when grandmother was alive that the family's no longer motivated to do, but maybe there's a new tradition that we can develop with our nuclear unit or a broader unit, and we meet somewhere else, or we have different gift exchanges, or not at all. And so it's really important for persons to be open to change, because sometimes one of the signs of mental illness is that we are avoiding change. We're avoiding exposure to events. And sometimes the confrontation, though it can be difficult, can be one of the most transformative pieces. And so sometimes it can help to speak to a mental health professional at this time of the year. Sometimes persons receive support from clergy or from other faith-based resources in their community. So we just encourage people to look for support.
And in looking for support, when should I be concerned, or my loved one be concerned, or anyone watching this program be concerned and seek help? When should I say, you know what, this is beyond being tired, this is beyond being just exhausted, running around the mall or whatever, dealing with family members or what, I might need to go talk to somebody? When do we move into that trying to or seeking to access care stage?
Sometimes that decision can be based on the passage of time. And
Okay.
so, as I mentioned with depression, if someone is experiencing many of the symptoms that I mentioned before for more than 2 weeks, there may be some clinical depression that is going on. Sometimes we recognize that in ourselves, but more often when we're around caring others, they might say something that will bring us to attention of how things are qualitatively different than they have been, and they may encourage us to seek help. And so that is why it's important, whether it's your biological family or a family of your choosing, it can be really important to be connected to others so that there's some mutual monitoring that is going on. Because if, for example, someone has multiple days where they are sleeping later and later and finding it difficult to get out of bed, or if they're experiencing what we would call within our community of mental health professions, they're experiencing functional impairment, then that can be a sign that, okay, well, you're not really working as your employer would have you to work, or you're not really parenting in the way that ideally you would like to parent. You're not really handling business as you have in the past. That's also another important sign that it is time to seek professional help.
I want to talk about this book. Talk about what led you to engage in this project.
So as a person who has been in school for many years of my life, writing has been something that has always naturally come to me. And for a number of years when I was teaching at Duke Divinity School, I was writing more academically focused works, and they tended to be more dense and maybe a little less accessible. And so when I decided to leave the Armstrong Center and started thinking more about the needs of the community, I began to think about what kind of resource could be very accessible, very understandable to a cross-section of the community, and thus could be something that would be inspiring, that something that persons would actually read and be able to put into practice. And so persons who read this book will find that there's an opportunity to learn from case vignettes about mental illness, to have a better understanding of what it looks like and what the symptoms are. But really, the greater portion of the book is focused on wellness. And so even when we no longer have symptoms of mental illness and we don't meet criteria for a diagnosis, we aren't necessarily well. Wellness means that we are really paying attention to how we are enhancing ourselves and each other in mind, body, soul, and spirit. And so the book is broken up into those different parts. It allows each person to take an inventory at the beginning. They take the Blossoming Hope inventory, and then they're able to determine, okay, here's my score in these different areas. Here's where I want to focus first on how I can improve myself. And so the book is written in those sections, and the CD goes along with it, because at different points in the book, you will be prompted to listen to a song that may be inspiring to you on that specific topic, or to engage in a meditation, or to repeat some affirmations, or to engage in a prayer. And so they go together as a set, and it was my hope that having this multimedia approach would really impact persons in a much deeper way than some of our traditional products out of psychology.
Amazing and phenomenal. And this is such a needed resource. Why women?
So I wanted to start with women, and as you may note from the title, specifically Black Christian women.
Right.
And so that's not a turnoff, hopefully, to the rest of the population.
Right.
But I wanted to start in a very specific way with Black Christian women,
Right.
because as I looked in Amazon and doing my market analysis, I realized that there aren't very many resources for us and about us.
Wow.
There are still messages within our faith that say, you don't get help. And so I wanted to provide a counter argument for why it can be helpful and healing to get help. And so I wanted to tend to that specific part of our population, and I wanted to address issues around history of Black women, because there is something specific about how we have been treated and regarded in our history that has a direct impact on how we think and we feel and we behave. And if we can allow some of those negative messages to step back while these more positive messages of our faith can step forward, then we're able to transcend to higher heights as God purposed us.
Thank you so much for your work. Thank you for being a blessing. Thank you for following the calling and listening to the Spirit within at a young age, as early as 12,
Yes.
and going down the path that God has led you to go down, because you are a treasure to us and so much needed. Thank everyone for tuning in. Again, we hope you enjoyed the show. Thank you for tuning in and watching our program. We hope that you found the information helpful.
Knowledge is power, and there's power in prevention, and you have power. So learn your ABCs, the A1C, blood pressure, and cholesterol.
And if you'd like to find out more information about our programs and services, or ways that you can live a healthier lifestyle, visit our website at www.chealthc.org. You can follow us on Twitter and like us on Facebook. And remember,
A healthy community includes you.